I know most of you have been waiting for the next keynote session. A very, very respected personality, IAS officer, Dr. Praveen Gedam, who's here, who's taken his very precious time, has delayed his meeting with a very key person. So we would like to call upon Dr. Praveen Gedam, who is the Agricultural Commissioner of Maharashtra. Let me repeat that. Agricultural Commissioner of Maharashtra. His dedication to public services and healthcare has truly been inspiring. So over to you, sir.
So thanks to organizers for having me here. After the wonderful talk of Amol on organization, motivation, and his, I'll prefer a collar mic. Story about Shackleton, how he created a kind of history, a case study, which is taught in most of the business schools now. I'm here to talk about how governments are enabling businesses through digital public infrastructure. I'll take a minute for...
So Praveen, we had a very short introduction of yours, and most of them are very interested to know a little bit about you. So I was not able to do the justice to your introduction, so we would want 1 or 2 minutes to spend. Yeah, thank you so much.
So I am MBBS doctor. I graduated from Nagpur in 2001. I joined Indian Administrative Service in 2002. I worked in several roles across the state of Maharashtra and also in the center. And my last role in the government of India, which ended a couple of years ago, was a mission director of India's digital health mission. So I will be focusing my talk broadly on the digital health part of digital public good. And since I left that position around 2 years ago, I'm not really aware of what has happened, but you will be able to understand the broad principles on which Government of India is moving ahead as far as digital public goods are concerned. After that, I went for masters abroad, and now I am handling agriculture in Maharashtra, so quite a bit of change. So this journey started sometimes in, and I'm sorry, this is an old presentation, I'll go back and forth. I'll also refer to some other digital public initiatives of government, and to tell how digital India is shaping. So public good, those of you who have some background of economics will be able to understand. For any economy to thrive, you enable businesses, entrepreneurs to run their businesses in most effective manner. So let us say we want to have a transport revolution. Think of USA in early part of 20th century. So they were on the brink of transport revolution. Ford was coming out with a very cheap vehicle. So we have, like, from Marutis to BMWs, all these businesses are there willing to sell their vehicles, cars, at some profit, so which keeps businesses going. But then where will these cars move? You need to have roads. So who will build the roads? Maruti is not going to do that, and BMW is not going to do that, because it's not generating any profit. So here comes the role of the government, because it is at this stage the market fails. The economists use the word market failure. And therefore, we need to have government intervention here, where from the taxpayers' money, you build a road. So that common public good is provided. So when you think of digital part of or digital ecosystem of India, there need to be somebody who will do that. And that role has to be taken by government at the taxpayers' money, so that innovators like you then can build on the top of that bottom layer and provide multiple solutions. So we can think of one very good example that India has is Aadhaar. And no other country in the world has digital identity at this scale. If I'm not wrong, the total budget of Aadhaar was like less than $1 billion, in which this project was conceptualized, designed, tested, and scaled up to the extent that it has come today. So every single person in India, their biometric and identity is captured in Aadhaar, and it has enabled you to provide what Amol said, single source of truth as far as identity is concerned. So you go to take a SIM card, you need to be identified as, like for example, if I go, I need to prove that I am Praveen Gedam. And how do I do that? General traditional method would require me to provide with my passport or say driving license, which can be easily forged. And then you have issues like those SIM cards being taken in somebody else's name, which can then lead to crimes and terrorist attacks and so on and so forth. Now you have to have just give your thumb or allow your face to be captured and your identity is proven, and therefore it enables quick eKYC. Now you build on top of it. So on the top of it, we have this Jan Dhan scheme of government, sometimes started sometimes in 2015, which enabled us to take our banking coverage from somewhere around 15-20% to right up to beyond 90%, because eKYC was possible quickly. So you could open the bank accounts. So then we have also had this mobile revolution. So we call this as a JAM Trinity, Jan Dhan, Aadhaar, Mobile. This JAM Trinity provides a foundation or a base level based on which various other innovations are built up. So you can think of an example, any digital revolution that you can think of, which India is doing better than other countries? UPI, right? Absolutely. And I'll be coming to that part, UPI, it's there in my presentation, how UPI was enabled, because government thought, so we have provided a public infrastructure, but then also let us set up some rules. Some of them are mandatory, some of them are like voluntary, not mandatory, and which will enable a thriving ecosystem. Now you think of a big e-commerce platform, like any platform which you want to purchase things, Amazon, Flipkart, or Zomato, Swiggy, and then there is a problem. You want to purchase something like this, the seller has to be on Amazon and purchaser has to be on Amazon. And otherwise it doesn't work out. And then Amazon can take out its profit, which can at times be very hefty, it can be very substantial. And then it becomes a monopoly, kind of digital monopoly. So we have now only Android and Apple ecosystems. And you know how their app stores, you have to play by their rules. So you have to break these rules also. How this was done in UPI, if you are in, say, I was in the US for last 1 year. I was studying there. And there are apps called Venmo and Zelle, which you use to transfer money. But both the persons should be on Venmo. Both the persons should be on Zelle. It doesn't happen in India. You can be on PhonePe, somebody else can be on Google Pay, and then you can still transfer money very seamlessly. And this is allowed because these digital silos are broken by rules, by having a proper set of protocols. Like you have in the case of internet, you have these SMTPs and all that, which allows you to send email from Gmail to Hotmail to Yahoo, whatever, something like this. So these are the broad strategies based on which India's digital health story has moved forward. So ABDM is one such example. I'll go back and forth between health and general government strategy. So Ayushman Bharat Digital Mission. This was conceptualized, and our Prime Minister, in the month of June 2020, he was taking a general review meeting of reviewing the COVID response. And then it was realized that there is sudden Zoomification of the world. Everybody is very comfortable meeting on Zoom, etc. So how do we take this into a health, which was the real issue that was grappling? And we already had our report. How can we move forward? That policy was already there. So he said, this is the right time to launch this mission. Now there is a problem here and in the financial or fintech ecosystem. In fintech ecosystem, when the UPI was rolled out, all the banks were already computerized, digitized, and that common connecting backbone, it enabled that interoperability very fast. In the case of health, I'm sure even if you go to the senior most consultant in top hospitals, more often than not you will see them using paper and pen, and it's like if you go to a general practitioner, it is generally the case. So it's the probably the least digitized part of our everyday's life. So there were double challenges to digitize the general health ecosystem and to provide the connecting bone. What has happened over the last 4 years is that connecting rod is already in place. Now things are getting digitized slowly and steadily, but then there is a pressure. In the US, consultant will see less than 10 patients in a day. In India, it's mostly above 50 per day. So it's not that easy to go ahead, but that road has been laid out, and we are waiting for Jaguars and Marutis to come. So what are the problems in health side? The identity. You are a very good techie. You develop an excellent teleconsultation platform and roll it out, and you provide it to the people. Okay, here is my platform, Practo or whatever. And then there is a problem. That problem is, how do you know that the person who has claimed to be a doctor is actually a doctor? And that's a rampant problem in India. Or somebody who claims to be a gastroenterologist is actually a gastroenterologist and not only MD internal medicine. There is no way, right? And then there is a cost of confirming that, which is sometimes somewhere between 5,000 rupees to say 10,000 rupees to confirm that, okay, he is actually a doctor with these credentials and that much of experience. So what government did was to provide an identity in the form of common registry of doctor, which government said, okay, we will take the responsibility. If you plug into our registry through APIs and run your platform, you can say, your entry barrier is basically reduced and you can basically compete with the leading players such as Practos. So that was the challenge of digital identity. The second one is of standardization. Standardization means, again, medical field is very different from engineering field. So in engineering, you have like a very set 1 + 1 is equal to 2. And computer understands that language of 0, 1 and your codes. But in medicine, you go to 2 different doctors. One doctor will say, okay, he has diabetes. The other one will say he has diabetes mellitus. The third one writes DM. And that's that's the language that computer will not understand. So you have to have that standardization and across the names such as organs, diseases, medicines, every single thing, symptoms, signs, everything. Interoperability problem. The problem with interoperability that you go to a Ruby hospital, they use one system, then you go to Jahangir, they use different system, and the Jahangir doctor cannot see what was written by the Ruby hospital because their systems are totally different, and then there is no connecting backbone. And the privacy and security, you all are aware of these issues, I will not spend time. So we discussed about Aadhaar, we discussed about UPI. I saw it was like 1300 crore plus UPI transactions in 1 month that we have achieved so far. It's like 1.5 times. Now this was the first digital public good when it comes to digital health, CoWIN. And I'm sure everybody must be now having so how this was done, and this was done in I think less than a month. This was done in less than a month with the help of private people like you. So far we have clocked 2.2 billion, more than 220 crore vaccinations. And so how this was done, few modules were developed. So there is a module of appointment booking, creating slots, something like booking.com, and then storing records, etc. And APIs were exposed, and all the entities such as, let us say, Apollo Hospital, and then Paytm, and every single entity was asked, okay, you can plug into this. So you have a CoWIN base into which there are 200 plus various applications which are plugged in. So you can select hospital from cowin.gov.in, book your appointment, go to the hospital, then the hospital uses its own software, let us say Ruby or Jahangir software or Pune Hospital software, to record your this vaccination event, and you go home and use your WhatsApp to download. So something like this, it was enabled by this digital public good, that is CoWIN. Now there is one concern here, if you can, one of you tell, which is can be taken care of by a proper technical solution, but still from political point of view, from the perception point of view, there is one concern. The government has these 2.2 billion records in server which is with the government. So government knows your vaccination status. Now you are still okay with that because it is required to be checked at say airport or whatever. But you probably will not be comfortable if the government says, let me have your psychiatric record, whether you are having depression, marital discord, or if you are having any sexually transmitted diseases, then people probably will not be comfortable in providing all that database in a server which is with the government. Now there are enough technical solutions to ensure that it actually remains private. And many of us are actually keeping these records on Google or Apple Cloud and with enough comfort. But this creates a political problem. It will not be acceptable and it will lead to a political chaos. So what is the solution? The solution is to have federated architecture. So again, I go back to the same examples, Ruby Hospital, Jahangir Hospital, Pune Hospital, let us say Sassoon Hospital also. All of them are having their own servers. Let them keep their records in their own servers. In any case, they are having records of their patient in physical form. So let's think of the same thing in digital equivalent ecosystem. And we just provide a pipeline. So this federated architecture is at the heart of digital health ecosystem. So we discussed this CoWIN portal. So I also touched upon this stack. So as I said, the bottom layer is a jam trinity. Then we have digital registries. This health claims is still a work in progress. And then health record standards, etc. So, and then we decided some protocols to exchange information. We decided on some standards which are to be adopted for writing medical records so that this interoperability, semantic, syntactic, both will be facilitated. And then APIs were exposed and people like you then were asked to provide with various applications. Now health is a very complex system, unlike finance where you are dealing with only banking. Here you have laboratories, you have yoga centers, you have like OPDs, inpatients, operations, and everybody's requirement is different. My requirement as a patient, I want to see what are the booking slots available in which hospital for which specialty and book that. A requirement of doctor is to ensure that I get records from all the different hospitals and vaccination records from the childhood on my screen. That's a different user interface. My requirement as a administrator or a government is to see a dashboard, how a particular, say, how the cases of fever with, say, chills and rigors, they are behaving in space and time, and I want to see it on a dashboard so that I can have a proper public health monitoring to identify the epidemic at earliest and I can do some intervention. So all these are different requirements. So what we do, we provide this basic modules and we allow market to develop their solutions. Now there are some good startups, 8,000 plus startups in India which are working in health tech sector. And once this is done, there is let us say a system which is developed. Let us say Sassoon Hospital is using a system called by NIC, a government health management information system, and creating and generating records. So we call it a health information provider. And I go to another hospital or a clinic or a laboratory, they want to access that information. So what happens? These unique identities given to a patient doctor, hospital, and the consent manager, that digital artifact which ensures that the record is shared only after consent of the patient is given, consent of the data principal as they call it. And then that record is exchanged. Once the handshake is done, the record is exchanged bypassing government system. So the record doesn't come to you. What happens is only shake hand is done through government system, and the record exchange can happen bypassing it. So this is the role of digital public good. Now there is one more thing. Why only government should provide a consent manager? It can be done by private. So that thing has also been enabled in the overall architecture of this system. So we discussed this. So traditionally we have had these Cerner and Epic. These are two biggest health tech companies in US, and they work in silos like Amazon and Flipkart. So what we did was something like this, which you have seen in case of emails early in 90s, but also in UPI. And another example, if you are aware, is ONDC, the Open Network for Digital Commerce, where all these Amazons, Flipkart, Zomatos, they can start interacting with each other. And hopefully this will lead to a ecosystem which is big enough so that monopolies are not created in the market. And then, so this is how the journey of digital health, basic digital health mission has been so far. I am not there for last like couple of years into it, but I remember this report of BCG and Credit Suisse, which says that impact of ABDM in 1 decade can be up to $200 billion. I actually called them back to cross-verify whether they actually meant billion or million, but they said, okay, it can be $1 billion. Why? Because of the efficiencies in the processes. So you save your travel time to go to a hospital, you can just have teleconsultation, and also create new opportunities. How? Like every single village need not have a specialist. So you can have a kiosk which works as a, we already have like city, this CSCs or common service centers, so they can develop as a teleconsultation setups in small villages. So it creates those kind of additional opportunities. So, and we have like most of the major players in India who are working with the government. But as I said, this has been a very slow moving for the reason that health ecosystem itself is not digitized. And you actually, because of the work pressure and adoption issues, you actually are very comfortable with the pen and paper. So that's one part which is lagging. But I am sure in another 5 or 10 years, we will have once that ecosystem is digitized, then you will not be stuck up with the problem in which USA is stuck up right now. That is a problem of silos. You will be having a seamless interoperability. And let us see what kind of opportunities you have. So you can easily think of booking, availing a facility, teleconsultation, physical or in hybrid mode or whatever. Then these are some terms in health tech like clinical decision support system. So once you have enough database of signs, symptoms, diseases, treatments, and doctor starts typing a patient, 40-year-old male patient with a complaint of this thing, there's a possibility of diagnosis keeps coming on your screen. And this is already happening. I've seen it in India in a number of places. Then possibility of possible treatments to be given keeps coming. So it reduces the cost of healthcare, which is so important in India. Then also health insurance is one area which is expanding rapidly. So you can think, and then there is this thing, preventive wellness, diagnostics, treatment, Ayush, yoga, wellness, and you decide what kind of product you want to build. You want to go very specialized, only dialysis, or you want to go horizontal, that okay, I want to cover everything. It's up to you. So based on your aptitude, your interest, your skills, your customer base, area where you are working in Tamil Nadu, develop it in Tamil language. So all these things you can develop a solution which can run upon the digital public good, that is registries and protocols and standards and consent manager that is provided by government, and develop your solution. So this has been the journey so far as far as India's digital health ecosystem is concerned. I'm very happy to tell, many people don't realize, so far we have created almost 60 crores, like almost 45% of India's population is having health account, because that was one of the step which was in the process of so when you registered for COVID vaccination, that was one of the step you want to create. And then, you know, all of us are very habitual, I agree. So many of you created, and that number is 60 crore. And so far, almost 35 or 40 crore records, health records have been linked to this health account number. So these 40 records are now in a position, 40 crore records are now can be accessed by any clinician, doctor, or your health locker, provided it is connected with the basic ABDM backbone. So that has been the journey so far. Thank you so much for calling me, and I can field questions, easy or difficult, as far as government is concerned. Please feel free to ask difficult questions. No need to, because I know it's the role we play has kind of mixed reviews, good and bad, so it's fine.
Dr. Praveen Gedam, thank you so much. It's a pleasure to have you as part of this conference. In general, we were discussing with a couple of our participants, and what you are leading is a big digital transformation, right? What are some of the challenges you have seen or faced as a leader in this transformation journey? And what's been your success mantra to handle those challenges? Maybe if you can throw some light on that.
So, okay, I have played different roles. So I'll come back to this example of health. So the challenge is you have to identify who are your stakeholders. So like my stakeholders are like patient, government, healthcare providers, insurance companies. Healthcare providers again has like 2-3 different subcategories. A doctor and a manager or a owner of the hospital, they need not have be aligned on their incentives and disincentives, because doctor wants to continue writing on this, owner wants to shift to digitization. So we identified set of incentives and disincentives. So when we dealt with individual group of say laboratories or pharmacies, we were aware what they like and what they don't like. And that was a whole different confidential document that we had, because, and I come from originally, my graduation is in medicine, so I was in a position to understand that. That's one part of it. Then you also have to allay fears and create enough transparency. So lot of the, so substantial part of code was written on GitHub, and you were in a position to fork it and suggest different ways forward. Then all the policy documents, they were first published as a draft. Suggestions, objections were taken, because we, government has learnt a lot from this Aadhaar experience of how things work. The moment this was rolled out, I remember within a month we received a letter from a very important government in the world, a foreign government, stating that this requires further consultation before India takes this forward. So all these issues keep cropping up. So you have to identify the landscape and then select proper set of people. Again, doctors and engineers, they are like vastly different group of people with different mentality, and you have to bring them together, make them work together, because you are basically working from them. And there was another challenge I remember, because in government we have a very rigid financial and HR policy. You hire with great difficulty, you fire with a, practically it's impossible. So so issue was that how do you develop that organization framework which is flexible enough and still within overall rules of the government. So that was a different challenge. And court cases, how do you convince judges that what we are doing is not going to allow government to track what individual person or say opposition person or a journalist is going through. So you have to convince them without using any technical jargon. So it was a complicated exercise, I would say, to come thus far. And thankfully, the team, there are people like you, mostly in Bangalore based, and some government officers. Like my direct boss was one gentleman called Dr. R.S. Sharma, who was the chief, there was like Nandan Nilekani, a political appointee, like a minister, and then he was kind of secretary when the Aadhaar was conceptualized and developed. So he had a lot of good insights to give, and then there were lawyers, media people, political people, which helped us. So it was a complex journey, I'll say.
Thank you. Yeah, so we have a chance for around 2 questions here.
Yeah, thanks, sir. Your second last slide before thank you means the as is situation. So I just want to ask you because, yeah, it's okay. Means in this hall, if there is somebody who is thinking to start something, since you are a doctor, right now what gap you see, okay, I want to have this solution faster. So somebody can take up the idea and develop on it. So I just want your insight as a doctor and a team member.
The problem in health ecosystem is not of tech, but of adoption. We don't, so you see, you have seen like those who are crossed 40 or 45, they are aware how old banking was. They were using registers, passbooks, you go, and now nobody goes to banks, and even if you go, it's all digitized. So in case of hospitals, it's not happening because a lot of things are like, say, mandatory fields. And if you see Indian doctor's prescription, at times it doesn't even have the name of patient. It's very common. So you want to have a user interface which is more suited to Indian context than Europe or North America. So how do you do that? You basically remove those mandatory fields, give that flexibility, also give that flexibility of a minimalistic design, and also ease with which you do, like, so one innovation which was done during the course of this journey was point and share, like the way you do for Paytm. So you just open your mobile, whatever health locker you are using. So there are some good apps like Eka Care and Briefcase. So you open, scan the code, and records are quickly shared. So basically, transaction time has to be reduced. Medical fraternity will not digitize if their OPD comes down from 50 to 35 or 40. They will probably digitize if it comes up to 45 and not below that. So they have that. So the problem, I think, is to have very ease of doing business का जो issue है. And I have been to hospitals abroad also. They have a luxury of time and resources. So consultant comes to a ward. He comes with 2 people who are like, on a wheel. They have a computer and couple of people who are typing for him. That's not going to happen in India. So you have to have tech solutions which are very user friendly, and then it's a matter of time when things will scale up.
Sorry, in the interest of time, probably we'll have to time box it. But Dr. Praveen will be available with us for a few more minutes, and during the tea break, we can have a conversation. I hope you all understand. Doctor, thank you so much for accepting our invite, despite of your busy schedules and being here. It was really a transformative experience for us. Thank you.
So they call it AgriStack. It's again in a very nascent stage. So they have done it in commerce, ONDC. They have done fintech has been absolutely successful. Health is again in infant stages. AgriStack is even at the stage before this. So you have identities of farmers, crops, everything. Then you have a data like which you capture from various satellites. And then you have photographs of crops. So you can take a photo, then AI engine is identifying which kind of disease based on the weather data. Again, you have enough things going on there. And then probably a farmer will be able to see, okay, what kind of pesticide he needs to spray now. So all these things are going on. Again, this is AgriStack. You will see probably results 5 years down the line, at least, not before that. Thank you.
Thank you. Thank you so much, Dr. Praveen. So it's truly inspirational, right? MBBS by education, IAS by profession, and having so much of information about technology. With this, I would like to invite Manju, Shri Harsha, and Shri to please Vijay to felicitate our Dr. Praveen.
Amol, please join us. Yeah, please.
Praveen sir, one compliment, not a question. So I was in Florida and San Francisco last in USA, and the way they have been checking the COVID certificate, anybody having to the US is like in just paper, they're writing in maybe pencil.
Yeah, I did my third or fourth dose in USA, and after this thing, they gave me a chit which was of the size of visiting card, and they wrote the name and they said, "मतलब आप अपना नाम लिख लो." So basically, I could have written name of my brother or whatever.
Exactly, and I was shocked, like when the way they were checking the COVID. Excuse me, your COVID done? Yeah. And our Arugya Setu, so big congratulations for that. Arugya Setu is amazing. To be like at this scale.
We at IT companies are bogged down by the transformation. हम लोग डरते हैं. But ये transformation देखिए, and that's why amazing live kind of, yeah.
Thank you, Dr. Praveen.
Yeah.
And I think it's a collective effort, right? It's not just the technologists, but we all are equally contributing to it. I think it is Indians who have taken themselves to the next level. And in fact, we can see people from the villages are also making the online payments. I'm sure all of you must have seen those videos the news channels were airing. A few Germans by the roadside, they were buying a vegetable and making the online payment. So I think we all are equally responsible for it, and I'm glad that we have such visionary leaders with us. Thank you so much. With that, I'll call upon some of the authors that we have in-house today. I'll invite Mr. Rama, Sandeep, and Saili, who have co-authored Agile Alchemy, a book that focuses on agile transformation approaches.
In the meantime, if you have any questions for Dr. Praveen, he's gracious enough to wait here after this session for about 15 minutes in tea time. If you have any questions, just come forward and ask. Like she asked about what can be done in the healthcare industry. So anything on that platform. So please wait here if you want to.